My name is Roland Diom. I am an RN with Custom Care Hospice. I started this journey a long time ago, 2009, as an aide for the same company, and I proceeded to Midwestern State University in Wichita Falls, where I completed my BSN program. And after that, I worked in the intensive care unit all over Texas, Nevada, California. But at the back of my mind, I always knew that I wanted to come back to hospice at some point because I had been so touched by my time as an aide that I wanted to come back as a case manager. And I am so glad that I had this opportunity with Custom Care Hospice. I knew that I could be more impactful to patients and families that were on hospice, just being there for them and managing their care to make sure that they have the resources that they need during this process. And even after the patient is long gone, that they still have resources to grieve appropriately. There were many times when I was in the ICU that I saw patients that were totally appropriate for hospice. But because the families did not understand the concept, what hospice was about, or they had misconceptions about hospice, they would not let their loved one have the comfort that they needed at that time in their lives. To me, I'm making more of an impact now that I can, comfortably talk to patients or their families about the kind of care, exceptional care, that Custom Care Hospice provides for their loved one, and even for them, even the spiritual aspect of it, because there are so many layers to it that I think a lot of people don't understand. But just playing that central role as a case manager, it gives me, in fact, a lot of gratitude just being in that role and being an anchor sometimes for patients that have no family, so to speak. I have several stories actually about my interaction with patients and their families that have, left a very deep impression on me. And mind you, I approached them thinking that they were not going to be receptive because of something that I had seen their loved one going through. But fortunately, the family was not that resistant. In fact, they were very welcoming to the idea. And I got a text message from the patient's daughter saying that they were very happy that I did notice that the mom was struggling. The truth about hospice is that not everybody is welcoming of this idea when they hear about it the first time. That's because they have been very used to a certain way of life. And now it appears it's about to change. Over time, when their loved one is already on services, they realize that a heavy weight has been lifted off their shoulders, and most often than not, they are very appreciative of the care. In nursing homes, it's difficult sometimes for family to get a hold of anybody. But when the loved one is assigned to a hospice care manager, they have our cell phone numbers. They can reach us at any time, sometimes in the middle of the night if they feel like their loved one is going through a crisis. And we are always there to give them pointers or to actually send somebody to come out and assess the patient, which provides peace and comfort knowing that we are just a phone call away. Being that I was at Custom Care 12 years ago and had all these other experiences and came back, I have seen the tremendous growth that Custom Care has experienced over time. And I am just so excited to be a part of this growth at this moment. I have built a lot of relationships. My aides, we have a very strong bond with other nurses. We even find time sometimes to hang out. We have a very strong bond, and it's not just because of work. It's because they care about me as a person. And usually that is what makes the most difference, because I know that if I'm going through something that is not even work related, I can always talk to them about it and I would get the best response or feedback. And these are just very unique individuals that really care about our patients, and I am honored.